Do you guys have audibility in the back there? You good? All right. Well, first of all, definite Catholic Church. We got seats up front here if anybody wants to come up. But if you're comfortable, just stay where you're at and help yourselves to all the good stuff going on. First of all, I just want to a round of applause for Lisa and all of her servers and both Lisas who have just done phenomenal work. So I'm John Ooney. I'm the pastor here at St. Cecilia, and just want to thank all of you for coming here tonight. You know, sometimes you can go to events like this, and they're great causes, all the good right stuff, but they're like my homilies, interminable. They just don't seem to end as the night goes on. And one of the beautiful things here about HEI and our event tonight is there is takeoff and landing. So it's a good thing. So you can even go out and, if you're not full, grab some dinner after this. I'm here to kind of welcome everybody and how lucky, actually, how blessed we are to be here in Boston, have this beautiful space, but also to honor somebody who has made such a difference in my life personally, so many lives. Brian, your wife, Jeff and Dana and Brooke, your mom, the Nini of those beautiful grandkids, Cindy, your sister, but our good friend Sharon McNally. So I just want to, in advance, say thank you. And I know I speak on behalf of Connor, who's coming up in a minute, and Lise and Dr. Michelle David, the chair of the board, our exceptional board, Beth Floor, who works tirelessly behind the scenes, making. We have this phrase, GSD. We get stuff done. And we're in church, so we get stuff done, right, Beth? Beth just makes things happen. Barry, but all of you. I just want to welcome all of you here tonight. It's an honor. And I think tonight is a good time for us to sit with something that's really good. Look at all the stuff, partisan politics aside, leanings aside. Look at all that's happening in the country, all that's happening in the world, all that's happening in people's lives as individuals, as families. There's so much fracture, right? There's so much division. And tonight is just putting all of that off to the side, like turning that volume down and focusing on something that's good and real and meaningful in a place that can easily be. See ya. I'm tired of it. We get enough stuff going on here. So the fact that you're all here tonight says so much about all of you as individuals and collectively. So thank you for coming to celebrate something really good tonight. Health Equity International, St. Boniface Hospital. Jerry, where are you? The row of the Padres here. You and that handful of others. Dick, you know, it's just all that you did with so many beautiful people to start St. Boniface, and now look where it is today as really the only functioning healthcare facility remaining in the country. Think about that. Little podunk, Fond de Blanc, that started out in 2 closets, right? You know, it's very small, and now it's the largest fully functioning healthcare facility. It's not just staying power through the good times and the bad, you know, coup after coup, gang after gang. It's because it's a mission and it's a commitment, and that's what St. Boniface HEI is all about. It is truly good. As you know, from Haiti, these last few years have been incredibly difficult. We used to go down there all the time. Connor, you were down there a gazillion times. Lise, right? Like, you just can't go down there. It's not safe right now. And so what happens is it can feel like the world is turning a blind eye to what's going on there. There's that whole thing of Haiti fatigue, like, oh my God, they're never going to get their act together. So does that mean you forget people? No. And especially with all that's happening at St. Boniface. So we, and I mean all of us, are the community of Health Equity International, and we're making sure it doesn't happen. And that's what being here tonight is all about. 24 hours a day, staff are caring for patients with the greatest needs in the most awful of circumstances. And they just don't stop. Patients get seen no matter what's going on. So tonight, it is that tremendous honor for us to be celebrating Sharon McNally, who has not only been an incredible force for good at HEI, but also throughout Greater Boston. You guys could get up here and speak much more authentically and articulately about your experience of your mom and your wife and your sister and our friend. But Sharon, you know, when I think, Brooke, one of your kids' first baptisms, right? And then Sharon, we kind of connected with you and Brian, and our friendship has gone through Jean, you know, your linking of our friendship too, and all of us coming together in different ways. It's just been fantastic. But your work with Jack Connors at Camp Harborview, I mean, by the way, it's like the best thing going, and I don't even know if everybody knows about what goes on at Camp Harborview, and you run this beautifully. The Clergy Trust, you know, and you know, my fellow colleagues, my brothers, my mentors actually, the priests over here, you know, the Clergy Trust for the Archdiocese takes care of the healthcare needs and the retirement, and Sharon is now in that exalted role on the board there, just like you need another thing to be doing. And just a true friend, a true friend. I mean, she's the kind of person that she'll tell you, like, if you need a haircut, to get a haircut. I know, you told me earlier. I know. Yeah, there's not too many left, but anyway, that's why I get the flow going on the back to make up for what's not happening in the front. Anyway, I think I've overstepped my bounds there, time bounds, so it's time to, Lisa's probably like, wrap this up right now. Anyway, it's my great honor to introduce the guy that just makes so much happen. He is such a low-key guy who really, GSD, gets stuff done, and that is the president and CEO of Health Equity International, my friend and great example, Connor Shapiro.
Thank you, everyone, for being here tonight, and it's an honor to be with all of you. A big thank you to Father John and everyone here at St. Cecilia's for hosting us tonight. We're really grateful. This is an incredible space. It's a little different from the church basement I grew up in New Jersey, but it's an amazing space, and we're lucky to be able to use it. Thank you. Thank you. Thank you. We're just really excited to be here with everyone tonight to honor our team's work in Haiti and to honor our good friend Sharon McNally. As everyone knows, this has been a very difficult year, and I want to acknowledge everyone on our tremendous team here in Boston. If you work at HEI and are on the Boston team, if you could please just raise your hand so we can acknowledge you for the work you've done over the past year. It's incredible. You know, even tonight, people have been asking, you know, are we tracking Tropical Storm Hélène, which is now off the coast of Haiti? And we are, and our team has been tracking it and trying to figure out how to support our colleagues in Haiti as they deal with torrential rains. We're hopeful that it doesn't result in anything too damaging, but the constant churn of crisis and crisis management and the grit that our team shows both here on the board and in Haiti is just incredible, and very fortunate to be part of it. We are Health Equity International. And I know there's a lot of friendly faces, but I just want to make sure that everybody is aware of the work that we do. Our organization runs a 150-bed hospital in one of the more remote regions of the southern peninsula of Haiti, and we are the largest fully functional hospital in Haiti at this time. We also run community health programs in some of the more remote regions around the hospital to make sure that we're reaching the most vulnerable in the hardest to reach places. We are the largest hospital, fully functional hospital, in a country of 11 million people. To put that in perspective, it would be as if Mount Auburn in Cambridge was the only fully functional hospital for the entire population of New England. The weight of this responsibility is enormous, and we have faced incredible challenges in our 40-plus year history. But the violence and devastation of the past 7 years of humanitarian crisis, combined with the cruel cut of U.S. foreign aid, has really presented challenges that have been unprecedented for us, that we've never had to face before. At the beginning of this year, we lost our USAID funding, and it forced us to shut down a program that was critical for helping healthcare throughout the Southern Peninsula. We also were forced to stop a decades-long HIV/AIDS program in the country. And it also made it much more difficult for us to provide maternal and child health services. It's also been a difficult year in terms of supply chain. It's been harder than ever to find, ship, and transport critical medicines and supplies to the hospital. There's also been an extreme rise in hunger in Haiti. And there's been a burden of care shifting from other hospitals that have had to close under the tremendous amount of insecurity in the country to our hospital, and we're getting sicker and sicker patients as a result. Finally, just acknowledge that resilience has a limit. I mean, at some point, there's a significant psychological toll on our staff and our patients in terms of all that's gone on. But with all of that difficult news, there is every reason to celebrate how our team has responded to all of those difficult challenges over the past year. Even though we lost that USAID funding, we were able to reach out to many of you here in the room to help us through this difficult time, and our doors have remained open at the hospital 24/7, and we saw over 130,000 patient visits over the past year. We saw over 6,500 ER visits. We had nearly 4,000 surgical procedures done at the hospital, over 3,300 babies delivered, and nearly 1,000 neonatal intensive care unit admissions. That includes 41 babies yesterday in the NICU when we last checked in with the team there. Our supply chain team has been able to overcome all the supply chain challenges, and we've actually moved more goods in the last few weeks than we have in the previous few months. We've found barges to go around gang violence and get essential meds and supplies to the hospital so that all the doctors and nurses have what they need to prescribe and on time. We've installed a new solar grid so that we're completely independent of diesel fuel and no longer have to rely on diesel generators in the way that we did before, which continues the sustainability of the hospital. And we have a new oxygen production system at the hospital to ensure that we always have this precious resource. And even amidst all this hardship, we've introduced state-of-the-art new equipment. We have new ultrasounds, ultra-modern ultrasounds, and some other medical equipment that we've recently been able to deliver to the hospital. And we've continued to support partner hospitals throughout the region, whether by sharing resources with them or providing critical training. I know right now it's hard not to give way to despair. There is so much pain and suffering, not just in Haiti, but around the world and here at home in the US, in ways we'd hope we'd never have to see. I urge you, when you feel overwhelmed by the enormity of Haiti's problems and the world's problems, to keep coming back to the fact that what we are doing here together is good. What we are doing here is right, and it is having a massive impact for our patients. When it feels difficult to know what to do in the face of so much urgent need, remember that you can do something. Remember 40 years ago, over 40 years ago, there was no access to health care in Fond-de-Blanc, and there was no clinic to offer care. So we did something about it. Little by little, person by person, dollar by dollar, year after year, we built, all of us together, a beacon of hope that still shines in the mountains of southern Haiti. A refuge, a place of healing, a place of peace. In these dark times, let us never forget that the work that we do is remarkable. It is necessary, it is just, and it is right. It's now my great pleasure to show you a little bit of our work firsthand in Haiti through a video put together by Lisa Epic and her team. In this video, titled Keeping the Lights On, you'll follow 3 stories of real patients at St. Boniface Hospital. Through their stories, we'll see how St. Boniface Hospital never stops, no matter how late the hour or how complicated the case. In the second part of the video, We'll hear from some of our longtime friends and partners and supporters about why they believe it is so important to stand with the people of Haiti and our organization in this moment, and why they believe in our work. I hope you find yourself in their words.
Night falls over the mountains. A woman in labor begins her walk, one hand on her belly, one hand clutching her husband's arm. Marie has walked this road before, but always returned with empty arms. Tonight, she keeps moving towards the glow of St. Boniface Hospital. In Haiti, people journey miles for care. Joseph is in heart failure. He leans hard on his wife, each breath a struggle. A mother walks through the night to get care for Sophia, her feverish child. All paths converge on the hospital that never sleeps. St. Boniface keeps the lights on. The hospital doors open. Marie is met by calm voices, steady hands guiding her inside. The team moves fast, not frantic, focused, aware that time is short. They get to work. Across the hospital, Joseph fights for breath. Oxygen starts flowing. Sophia weakens. A nurse starts an IV, whispering comfort. Meanwhile, in the maternity ward, monitors blink on. Inside, every second counts. Marie grips the nurse's hand, praying this time will be different. The baby's in distress. Marie needs an emergency C-section, and she's in the right place. The team moves fast. Around them, the hospital hums. Joseph is still struggling. Sophia's mother worries by her side. The work continues. On the table beneath the bright light, Marie trusts the hands around her. The room narrows, voices low, movements quick. For a moment, everyone holds their breath. Dawn breaks over the hills. A new baby cries. She's strong and spirited. Joseph breathes easy. Sophia's fever breaks. Marie gathers her baby in her arms. The baby she thought she'd never hold. The night is over.
We are witnessing probably one of the most difficult moments Haiti has ever experienced. I don't say that lightly. It is not an overstatement.
There's an enormous burden right now. There's an enormous need.
Haiti needs services like Health Equity International more than ever before.
At a time when the Haitian public health system has truly imploded and there's a real absence of ability for the government to provide care to people, the importance of St. Boniface can't be overstated.
And the fact that St. Boniface has stayed open is an incredible miracle.
When others must close or scale back, our team keeps showing up day and night because lives depends on it.
Hospitals like St. Boniface are critical infrastructure for all countries, especially those that are navigating the layered crises like Haiti.
Women with complicated pregnancies, where will they go? Those services don't stop. Even under this situation, those services do not stop.
When I've seen parents with their babies in their arms waiting outside of these hospitals, when you talk to them and they've traveled so long to try to save a loved one's life, it's just so incredible and so important to have some place to go.
You have to believe that the impossible is possible, even in the most destitute of moments, which I believe is right now.
Health Equity International St. Boniface Hospital is a beacon of hope, proof that life-saving care is possible even in crisis.
When you look at the services that are being provided and how many people are benefiting, how many children and babies are benefiting, this is an extremely cost-effective proposition. But it is also a time when Haiti, this is a population that deserves much better than what they're getting.
I think the heart of why we give, for so many of us, is based upon the belief that all human life is equal and has value. And at this time in particular, our Haitian partners and colleagues need us more than ever.
The fact that there are people still working, still on the ground, still devoted to the country, to the day-to-day needs of people who are sometimes extraordinarily vulnerable and in great need is reason to hope. And it's reason to inspire more of us to get involved in whatever way we can.
We are called to be each other's keeper, regardless of the amount of money you have in your bank account. I'm just so grateful that the doors are still open at a moment where we are increasingly seeing it difficult for hospitals, for nonprofits to operate in Haiti, and yet there HEI is. And so HEI is committed. I have no choice to be committed.
We must work together to see Haiti thrive. And now is not the moment to look away. Now is the moment to collaborate, to invest, to build, to forge a path rooted in democracy, equity, and prosperity.
New England and Boston has stepped up over and over and over again. And it's hard not to feel some tremendous sense of shared pride in our work, in what we've been through together, what we will continue to go through. And at times like this, that's who I want to turn to and know that I have by my side, and I'll be with them forever.
It's now my great honor to share a few words about this year's, I think, reluctant honoree, Sharon McNally. Yes. As many of you know, Sharon is the CEO of Camp Harborview, a one-of-a-kind summer camp and year-round leadership academy for over 1,000 children in Boston from historically marginalized communities. In addition to cultivating the leaders of tomorrow, Camp Harborview also provides services that help support the child's whole family, such as college and career planning, scholarships, clinical support, resource coordination, guaranteed income, and holiday assistance programs. And all of this comes at absolutely no cost to the families. In addition to running Camp Harborview, Sharon has simultaneously been the chief of staff in the Connors Family Office, where she supported the philanthropic, political, and business activities of the late Jack Connors, founder and former CEO of Hill Holiday. As if that weren't enough, and I know Father John talked about some of this, but I think bears repeating. Sharon also serves on the board and on our executive committee at Health Equity International. She is also the chair of the board of directors of Community Servings, co-chair of the Health Leads Massachusetts Advisory Council, chair of the Advancement Committee of the Clergy Health and Retirement Fund of the Archdiocese of Boston, Development Committee chair here at St. Cecilia Parish, immediate past chair of the board of directors of the Schwartz Center for Compassionate Healthcare. Enough? No, not enough. And past chair of the board of the Big Sister Association of Greater Boston. Anyone who has spent even a few minutes with Sharon can immediately tell what a powerful and generous force for good she is. Her energy, drive, and compassion have been transformational for our organization from day one. Whether it is helping guide a productive board meeting, reviewing difficult budget questions, reminding us of the importance of following our mission or finding last-minute free office space for eternity. Sharon has been an incredible leader for our organization at HEI. Thank you, Sharon. Thank you. Please. Yeah, please.
Thank you, Connor. As you know, from the very beginning when we talked about how this evening would unfold, I've maintained that as a relatively new board member, I did not belong in the pantheon of past honorees. Barry Landry, Beth Fleur, Father Jerry Osterman, Father John Uni. But when Beth Fleur makes the recommendation, the best idea is to just go with it. So here we are. So you've just heard about the remarkable work at St. Boniface Hospital in southern Haiti. Despite all the challenges, and you've heard there are many, from recurring natural disasters, another one perhaps in the making, to governance strains, to the chaotic impact of violence that disrupts every aspect of life, including healthcare, St. Boniface is open, and the staff remains unwavering in their commitment to life-saving care. I was in an Uber on Monday, and I started to chat with the Uber driver, which I always do, and sometimes I know they wish I wouldn't. But I was talking with this guy, and it was very clear to me very quickly that he was Haitian. So I said, "You're from Haiti?" And he said, "Yes, I am." And I said, "Do you know St. Boniface Hospital in Fondablanc?" And he said, "St. Boniface Hospital? It's the best hospital in Haiti. It's the only hospital that's still operating. It's saving lives. It's amazing." And I said, "Well, I know. I'm on the board of St. Boniface here in Boston, and I'm going to be with a lot of people who support St. Boniface on Thursday evening." So we talked a little bit more, and when I got out, he said, "God bless you, and God bless all the people you're going to be with on Thursday night." So blessings from Pierre to all of you tonight. So Father Jerry told me to be brief, so I'm going to be brief. But I want to say to the amazing staff at the hospital, whose skill and dedication keep the doors open, the pressure that they're under is amazing, and to Connor and the Boston team, who are so resolute and determined in their work in the face of budget cuts and supply chain problems and uncertainty and instability on all levels. You keep doing it. Congratulations on your steadfast impact on a country that seemingly at times the world has forgotten. It's really important work that you do, and I'm so proud of what you do. And if I may, a word about Connor, and I know you're not going to like this, but I'm sorry. I've known a lot of nonprofit CEOs and executive directors in the last 20 years. I have never seen a more perfect model of courageous and innovative leadership than the one that you provide. And to all of you who are here tonight, thank you for investing in St. Boniface. Your investment means so much. There are so many requests for your consideration. There are so many demands on your charity, and you've decided to help St. Boniface. And we are so grateful for the work that you're doing to help the staff, the patients, the community that comprise St. Boniface. Thank you so much. So the mission here is about building capacity that endures beyond the next grant cycle, beyond civic disorder and gang violence. We need to keep essential services running, reliable energy, supply chains, governance that can withstand the shocks and the traumas that we're seeing now. We do believe that there's a healthier, safer future for Haiti and for St. Boniface Hospital, and your partnership will help make it happen. Thank you so much for being here tonight. And Father Jerry, how did I do? Am I brief enough? Yeah. All right. Thank you all so much.
So Sharon, I was awkwardly standing over there on the side because we have a surprise announcement tonight. On behalf of all of us at Health Equity International and St. Boniface Hospital, in recognition of your tireless work helping children from Boston to Haiti receive the support they need to thrive, it is our great honor to announce that we are renaming the pediatric wing at St. Boniface Hospital as the McNally Family Pediatric Wing of the St. Boniface Hospital in Fond-du-Blanc, Haiti. Thank you. Thank you. Dr. Clermont, who couldn't be here tonight, on the left is the director of all of our work in Haiti. She is a true hero and the one who keeps everything going and keeps the lights on. She couldn't be here tonight, but she wanted to make sure that she was part of this picture for you, Sharon, and with the team in pulling this together. So thank you for your leadership, determination, and unwavering belief that every child deserves to reach their full potential and that all children are deserving of care. Thank you. But thank you, everyone, for your generosity tonight. Thank you for standing with us. There's envelopes in your program if you were not able to get to the square readers. But we actually finished up a little bit early. I don't know what the curfew is here at St. Cecilia's, Father John, but please stay, hang out. This is an incredible group of people and really fortunate to have all your support. Thank you all. Have a good night. Thanks, everybody.
You guys, we have no curfew. Probably should. It would have probably kept me out of trouble back in the day. But anyway, so we'd love for you to stay, make yourselves at home. But also, I know there's been a whole team effort to make tonight happen that's gone behind the scenes for so long. Connor, you just worked tirelessly. But the three Lisas, Lisa, want to thank all of you guys for all of this food, this organization. You guys have been remarkable, and all of your teams. Thank you.
Yeah, and just a quick shout out too to our dinner committee, Beth Floor, Sharon, Kate Action. We also had Michelle on there as well. Just a huge thank you to all that everyone did to make this possible. Thanks, everybody. Thanks all.